welcome to the WIHS Journal. On today's broadcast, we'll learn about the organization Athena that deals with hospice care. Today in the studio with me was Pastor Chris Adams and April Godioso. Stay tuned to hear all the details. Well, today in the WIHS studio is a different treat, something I've never done before. We'll be talking about something that people probably don't like to talk about, which is hospice. And today we'll be talking about the group Athena. And today we have in the studio with us, as everyone knows, Pastor Chris Adams. He is on the board of directors here at WIHS, and he is a pastor here in the community. And also we have in the studio is April and Pastor Chris. Thank you so much for being with us today and talking and clarifying the different parts of hospice. So April, introduce yourself to our listeners and tell us what you do there at Athena.
My name is April Godioso. I'm the Business Development Director at Athena Home Health and Hospice. And I am part of a team that coordinates with families and with patients and skilled nursing facilities and assisted livings, doctors' offices, anyone in the community really, to help educate and facilitate patients going on hospice when it's the right time.
So Athena, tell us a little bit about what that is. I've never heard of it before. What is Athena?
So Athena Healthcare has nursing homes in Connecticut, in Massachusetts, and Rhode Island. And we also have a continuum of care, which includes home health, hospice, and private duty care. So we use all of those services to service our patients the best way possible.
So how long has Athena been in existence?
So Athena as a company has been around since the 80s. Home health and hospice has been about 7 years.
You know, people hear hospice and we know that it literally means end term, but sometimes hospice can go on for years because I know my husband's a nurse. So what are some of the benefits about hospice?
Well, we focus primarily on comfort and quality of care. So when we're talking with families about when the right time is, we talk about quality versus quantity. You know, do you want the most amount of days you can get out of a person, or do you want the best days? And maybe that's a little bit less in number, but a lot more in experience.
So who determines that? And, you know, how does a team look if you have somebody who's elderly, and who makes a decision about hospice?
It's really the patient and the family make it, it's going to be different for everyone.
Yeah.
Whether or not they qualify for hospice care sometimes, is not the deciding factor. It's really about what their goals of care are. Do they want to aggressively treat their disease, or do they want to be comfortable and just spend time with their family and, enjoy the time that they have left?
So what kind of team goes together for a hospice team?
They call it the interdisciplinary team. Consists of our medical director, an MD, and then our executive director, our clinical director, clinical supervisors, and then we also have our nurse case managers, home health aides, social workers, chaplains, and home health aides, volunteers, and bereavement.
That's a lot of people.
That's a lot of people.
Yeah, that is. So in primary, do you work, I know you said it's all different parts of the aspects of a state. Primarily, what is your position? Is it here in Connecticut?
Yeah, so Athena Home Health and Hospice covers pretty much all of Connecticut. We service all 22 of our nursing homes, our Athena nursing homes in Connecticut. And then we also partner with assisted livings, other nursing homes, and doctors' offices, hospitals in the communities.
Yes. So tell us some of the benefits, how maybe your faith or how you have become strengthened by being in hospice, because this is a new role for you.
Yeah. A lot of things throughout the years I've learned and I've kind of noticed and observed. One thing I actually was just discussing not too long ago was that there is a tremendous will of people that we don't give enough credit to. Some people are kind of just looking at the science of it. These are her symptoms. This is what's going on with her, and this is how long we expect to live. And I have seen time and time and time again people who are waiting for a daughter, waiting for a son, waiting to feel ready. What that is, I don't know, but it's a feeling for sure. And I feel like that is the spirituality piece of it, just being at peace enough to kind of let go.
And thank you so much for sharing your heart and, your expertise in the hospice field. That's something that I'm learning about too. So Pastor Chris is here also with us in the WIHS studio. So Pastor Chris, I know you're a pastor. You've been a pastor and a singer. You're a singing chaplain too, which is awesome. He's not going to sing for us. This is going to be a serious interview. So tell us, I like to know, because you hear about people who get to the end of life and a hospice sometimes when they're in that morphine stage.
Yes. Well, as a pastor, I've been dealing with end-of-life ministry as a chaplain before for many, many years. Coming to Athena, you're dealing with it not as a single pastor, but as a part of a team. That's what hospice, the foundation of hospice care is. You have that care team, and the chaplaincy is a part of that care team that deals, when we talk about helping the person become comfortable, the family to become comfortable, each and every member of that team has a role. And we work in conjunction and tandem together with the common goal of helping to create and helping to maintain comfort and quality of life. The chaplaincy, we work with people from all faith backgrounds, not just Christian. We've had Muslim, Jewish, but even had those who aren't believers in really anything or anyone, but still require or still desire that spiritual outreach where they can know that they're being prepared for what's to come, the afterlife, if you will, what they sometimes are uncertain about. That kind of creates fear in some people's and uncertainty. So to have a chaplain available, I find, and I think we all find, helps to give them some sort of encouragement. As a pastor, I want people to know that there is an eternity awaiting them, and we want to make sure that to get that message out to them. Now, our goal as pastors is not to proselytize or to make somebody believe something, but we're there as a spiritual comfort, as a spiritual presence in their lives and the family life as well. One of the things that April mentioned is not only am I a chaplain for our patients and their families, but also for the staff too, because this kind of ministry takes a lot. It takes a lot of strain. Do you agree?
Yeah.
And so we find that our coworkers, they need spiritual encouragement too. Yeah. And so as a chaplain, I've often been called upon to pray with a staff member or what have you. So we provide, by God's grace and mercy, tremendous comfort and encouragement to them so that they can know that they're cared for, because we need to care for ourselves. Otherwise, how can we effectively care for other people, wouldn't you say?
My thing I was talking about when a patient is on the morphine and the family's talking to them. Have you seen instances or examples where the family who is about to end their life and go into the next realm of eternity, that they know that family's there? Can you give examples?
Would you like to speak to that first?
Yeah, I mean, it's definitely apparent when you're there that, they may have their eyes closed, they may be, barely breathing, barely there, but they can hear you. They can hear you. And the families that I have seen have really been able to take comfort in knowing that they're being acknowledged as what they're saying.
I loved hearing both of your scenarios about this wonderful organization, Athena. You guys go in nursing homes and hospitals and pretty much anywhere in Connecticut, right? Am I missing anything else out?
No, you got it.
Yeah.
Yep. Yes.
And one of the things I will say, what attracted me to Athena, because prior to working with Athena, I worked for about a year and a half with another hospice agency, is I heard that it was growing. This is 5 years ago, and as April has shared, it's been around about 7 years. In comparison to some of the other hospice programs, it's young, but growing, and that's where I wanted to be. I wanted to be into a place that was growing in ministry and mission, and that's why I came. The Lord led me to Athena.
So before we close, why don't you just mention the website for our listeners?
It's athenahealthcare.com.
Once again on the broadcast with us was April Godioso and Pastor Chris Adams from Athena, dealing with hospice care in every aspect of the families. For more details about today's broadcast, you can give us a call at 860 346-1049. The opinions expressed are those of the participants, not necessarily those of a staff and management of a station. I'm Anissa Porticelli for News and Public Affairs.